Hi, I'm Stephanie. I'm your nurse today, and I'm going to be conducting a wellness exam. Okay. I'm going to get you to state your name and your date of birth, please.
Courtney Wilson, October 1st, age 17.
Okay. And again, you're here for your wellness exam. Just to go through a little bit of information here. Oh, and I'm sorry, we also have mom here. That's also Tony Wilson.
Yes.
And just to go through a little bit of information here. You don't have any known allergies. Is this correct?
Correct.
Okay. No any current medical illnesses. No surgical history, no treatment history, no hospitalizations. You're not on any current medications, and you don't have any known allergies. Is correct? You are up to date with all your immunizations. Is this correct, Mom?
Yes.
And this includes Hep B, MMR, varicella, D type, and that also includes COVID and current COVID and flu vaccine. Is this correct, Mom?
Yes.
All right, wonderful. And then, Mom, just a couple questions for you.
Mm-hmm.
Are you able to let me know the dates of when she was smiling, rolling, sitting alone, and walking?
Um, Probably about 2 months for the smiling. Maybe when she first got home, you know. Um,
Okay.
let's see. What else did you say? Rolling over.
Mm-hmm.
Maybe about 3 months, two
Okay.
or 3 months. Um,
Sitting alone.
Sitting alone, sitting up. I guess about 3 or 4 months. I'm not sure, but yeah.
Okay. And walking.
Oh, that was a year old.
About a year old. Okay.
Mm-hmm.
All right. And did she have any developmental problems growing up?
Nope.
All right. Any issues with peers, behaviors, like
Nope.
thumb sucking, bedwetting, anything like that?
Mm-mm.
And was she breastfed or bottle fed?
Bottle fed.
All right. And at what age was she put on solid foods?
About 9 months.
9 months.
Mm-hmm.
And can you let me know her birth weight?
7 pounds 4 ounces.
7 pounds 4 ounces. And right now, your current living situation is. Can you let me know what your current living situation is?
Um, she lives with me.
All right. And Mom, what is your occupation?
Activities director.
And just a family medical history. Do you have any family medical history of anything? And this is including anything psychiatric, like mental retardation, schizophrenia, or anything of that nature?
Nope.
Okay, wonderful. All right, thank you. And Courtney, just to ask you a couple of questions. Are you currently sexually active?
No.
Okay. So then that's going to skip a whole lot of other questions that I was going to ask you that I'm not going to ask you now. Okay. So what the next part of this is going to include is the physical part, where I'm going to check vision, I'm going to check hearing, I'm going to look at your skin, I'm going to listen to your heart, listen to your lungs, listen to your stomach. I'm going to check your pulses, and I'm going to check your skin, and I'm going to look at you and see you walk back and forth. Okay. Mom, do you have any questions about anything that I'm going to do?
No.
Okay. Courtney, do you have any questions about anything that I'm going to do?
No.
Okay, wonderful. All right, so we're going to start now, and I'm going to start off by measuring the circumference of your head, okay?
Okay.
Okay, I'm going to go under your braids. Okay, we have the circumference at about 55 centimeters. All right. Now I'm just going to check your head. Any tenderness, any pain?
No.
All right, wonderful. Okay. Now what I'm going to have you do is take off your glasses for me. Okay. Now face me. What I'm going to have you do is follow my finger, okay? Now what I'm going to do is I'm going to take a look in your ears. As soon as I get the light on. Here we go. And I'm actually going to stop everything I'm doing right now so I can get your blood pressure. I should have done that first. Alright, go ahead and hold your arm out for me. Blood pressure is good, 110/70 mark. Okay, now what I want to do is I want to listen to your lung sounds, okay? So I'm going to have you take a couple of deep breaths in. Deep breath in. Deep breath. Deep breath. Deep breath. Now I'm going to listen to your heart for 1 minute, okay? Mom, are you able to time me for 1 minute if you don't mind?
Sure.
Thank you. Okay.
All right.
Okay. 78 is your heart rate. All right. Now, what I'm going to do is I'm going to check your skin. So I'm going to have you hold your arm straight out for me. Any pain when I touch your arms?
No.
Okay. Bring your arms this way for me. All right. Fold your wrist. Okay. Perfect. All right. What I'm going to do is check your reflexes now, okay? All right. I'm going to hit this on your knee. Just give me your natural reaction. Okay. Got any? Okay. Perfect. You reacting naturally. Okay. Now what I'm going to have you do is I'm going to have you lay down and I am going to listen to your belly. Okay? Are you having any stomach pains Are you having any stomach pains?
No.
Okay, and when was your last bowel movement?
This morning.
All right, and was it Was it okay? Were you find yourself pushing, or was it just naturally? Was it just natural?
A natural flow.
Natural flow. All right, that's what I like to hear. And is that happening daily for you?
Yes.
Okay. All right. Mom, did she have a good diet?
Yes.
Wonderful.
Lots of fruits and veggies.
Wonderful. Everything sounds good. All right. Write down all this information. All right. And just questions for you. Do you have any problem urinating?
No.
Have you had any have you noticed any blood in your urine
No.
or in your stool?
No.
Okay. And have you started your cycles yet? How old were you when you started your monthly cycles?
12.
12. Okay. And have you been having them regularly since?
Yes.
Okay. All right. Wonderful. Glad to hear. Okay. What I'm going to do is I'm going to check the pulses in your feet. Okay. So go ahead and lay back and put your feet next to each other, just like that. Perfect. Okay. All right. Thank you. You can go ahead and sit on up, Courtney. And just to ask you a couple questions, do you have any problems breathing? Do you ever find you have any problems breathing?
No.
Okay. And any problems? Do you have any problems? Any pains when you walk?
No.
Okay. Any pains when you actually speaking of that, I'm gonna have you go ahead and stand up for me. Okay. And I do want to see you take 4 steps forward for me. Go ahead. 1, 2,
3, 4.
All right, and turn around for me. Come back 4 steps.
1, 2, 3, 4.
Okay. All right, you come towards this way for me. And now what I want you to do is, can you squat down for me? All right, perfect. Do you have any pain where you're squatting?
No.
All right, wonderful. You can go ahead and stand up for me. I'm gonna come around here. And are you able to bend down and touch your toes, please? Okay, and I'm just checking your back. Do you have any pain in your back?
No.
Okay. All right, you can go ahead and stand up. All right, wonderful. Thank you. Go ahead and sit down. You go ahead and have a seat. Okay, all right. Well, it looks like Courtney is in wonderful shape, Mom. I'm going to go ahead and get the practitioner because that's not what I am. I just wanted to do the pre-test, the pre-assessment to see how Courtney was doing. So she's doing very well. I am going to go get the doctor, as I previously stated. Do you have any questions for me or concerns or comments or anything? Were there any complaints or anything that you wanted to make the doctor aware of prior to the doctor coming in?
No.
No?
No.
Okay, and Courtney, you're doing just fine?
Yes.
Okay, I want you to keep up the good work. Mom, I want you to keep up the good work and, whatever you're doing, how you're feeding your child and also helping whomever else that you're feeding, please continue forward doing that. And everyone is grateful. Your child is growing well. Thank you.
Thank you.
All right.